Thank you. I'm joined now by Bernard Nahlen, who comes to Notre Dame from his previous appointment as Deputy Director of the President's Malaria Initiative, placing him at the forefront of global health research and management. Effective December 1st of 2017, he became Director of Notre Dame's Eck Institute for Global Health and a Professor of Biological Sciences in the College of Science. Welcome, Bernard Nahlen. Thank you so much for being here.
Thanks. Happy to be here.
We're happy to have you on your first Notre Dame Day. Very exciting. How did you become involved in the President's Malaria Initiative?
Sure. Well, first of all, I did my undergraduate degree here at Notre Dame and then later went to medical school and did training at the Centers for Disease Control and Medical Epidemiology. Spent most of my career with the U.S. government working on neglected tropical diseases and malaria. Later at the World Health Organization. President Bush launched the President's Malaria Initiative in 2005, and I was asked to be Deputy Coordinator in 2007.
Okay, first of all, I'd like to say welcome back to Notre Dame. What was it like to work on an initiative with such national visibility and widespread potential impact?
Well, it was obviously a real privilege, first of all, to have from the highest levels of the U.S. government, the White House, Congress, and also the team that was put together to help run PMI, not just myself, was some of the most talented people I've ever worked with, but to be sitting with President Bush, later President Obama, and the leadership of Congress and the Senate, who all had rallied around this common agenda, was pretty wonderful.
That sounds very wonderful, very exciting. How does that broadly applicable experience inform your work at the Eck Institute for Global Health?
Well, actually, Notre Dame has been contributing to the malaria agenda for decades. I've worked with all sorts of people who've done their undergraduate, graduate, postdocs here at Notre Dame, so that's one reason I decided to come back to be part of this team. But the Eck Institute itself, part of this is making sure that we have a clear mission, that we have a clear strategy, that we have a plan and how we're going to get there, and that we all work together to move towards that.
You mentioned that mission and goal and strategy. What are some of your goals for the Eck Institute?
Well, part of it is to deepen what's already going on. You know, there's a Masters of Global Health, which is highly popular, very well run, and going very well. There's great research going on in not only the Department of Biology, but many other parts of the university. But one of the things I'd like to do is to broaden this out a bit to make sure that it's really an institute which all the faculty and students of the university can benefit from, and also to position it so that Notre Dame will be seen, as it already is, as sort of an indispensable player in the world of global health.
And how important is it for both our campus and our nation to have a consistent focus on global health?
Well, it's very important. I mean, obviously, I think from a Notre Dame perspective, you know, this is about the diseases we're working on affect the poorest of the poor. So it's sort of like the Catholic mission, the sort of preferential option for the poor. I think as far as the country goes, you know, we don't need to be reminded more frequently than we have been recently with outbreaks of Zika and Ebola, that we really aren't an island, that it's only a plane ride away where our own country can be affected by some of these diseases that sometimes seem so foreign. But I think the most important thing, it's just the right thing to do. I mean, it's an issue of justice. Most of us really don't want to live in a situation where half the world is sick and the other half is poor, particularly if we can do something about it. And I think that's the great thing about the American people. They are very generous, and they've been sort of indispensable players in the whole global health agenda.
All right. Well, thank you so much for joining us, Professor Nahlen. It's great to have you here on your first Notre Dame Day.
Happy to be here.